Can hearing aids help with mild hearing loss? That's our topic today on Ask the Hearing Doctors. Hi, I'm Jim Cuddy, and this is Ask the Hearing Doctors, and I'm joined today by Dr. Anna Anzola, Doctor of Audiology with Hearing Doctors, the Washington, D.C. area's highest-rated audiology practice with over 1,500 five-star reviews. Anna, great to see you as always.
Great to see you too.
So, what is considered mild hearing loss?
Sure, so by definition, a mild hearing loss is considered a deficit at 25 decibels up to 40 decibels, or dB.
To understand it better, what types of things might I be missing if I have mild hearing loss?
Well, that's kind of tricky, right? Because at such a low level, one may not be the one experiencing those type of changes, but you could say, you know, if I'm not listening to the birds or hearing the birds as well as I used to, or whispers if somebody leans over to say something to me, perhaps on the phone, now it's not as clear as it used to be, or in a restaurant with a lot of background noise.
So you could be potentially missing out on conversations in a situation like that. What other things could you really be missing out on and you might not even be aware of it?
Good relationships, because it's going to affect somebody's relationship with somebody else. You're missing out on conversations, but asking what too many times, and asking to put up the television volume a little higher than others. So that could be potentially a problem, not so much for you, but for others, right? And so it starts to affect other people sooner.
Those are signs then for somebody, if all of a sudden somebody's asking you, or if you're asking somebody to speak up a lot, it's probably time to get your ears checked.
Or repetition, right? Yeah. You're asking for that.
But if you only have mild hearing losses, what are the impacts? I mean, I would imagine it's not as devastating as with significant hearing loss.
Sure, but then we're looking more and more into the cognitive health of somebody's well-being, right? And so our structures and our auditory pathways can be impacted, and you're not even knowing. So we always recommend, if at the age of 50 you haven't had your first hearing test, it is always a great idea to have a baseline. Maybe you don't need hearing devices or treatment with some sort of, like a special phone or something like that, but maybe having a conversation with the audiologist or the hearing healthcare professional and talk about compensatory strategies. And if you have a baseline, then we always can go on from there. Maybe you get to see us every 6 months or every year, every 12 months or something like that. So we were talking about the adults, but what about that child that suffers from a mild hearing loss? And even at a mild, by definition, a mild hearing loss can impact their communication or their knowledge, their emotional well-being, or developmental struggles.
And as we've talked about in the past with hearing loss and cognitive health, and we've always kind of thought about it or talked about it when we're talking about people that have significant hearing loss. But this becomes an issue even with mild hearing loss.
Yes, so if the brain is getting only partial information, then the brain struggles more than it has to, and it will impact your abilities to interact with someone. So what we want is better engagement or an improvement on engagements and the ability to listen effortlessly.
So if you have any of these signs that we talked about before, the important thing is to get tested.
Yes.
Especially if you're 50 years old and you haven't been tested yet. My goodness, what are you waiting for?
Exactly.
But that way you just get to enjoy life.
Exactly.
Right. Anna, thank you so much.
Thank you so much.
If you're in the Washington metropolitan area and you'd like to schedule an appointment with Hearing Doctors, click the link in the description or visit hearingdoctors.com.